Well, good afternoon, everybody. I'd like to call this meeting of Renfrew County Housing Corporation to order. I assume the roll call has been taken, Wendy?
Yes, Mr. Chair, the roll has been taken.
Thank you very much. Are there any disclosures of pecuniary interest and or the general nature thereof? Seeing none, I'd like to get a mover and a seconder to adopt the minutes of the meeting of January 13th, 2021. Moved by Councillor Arrears, seconded by Councillor Giacono. Are there any additions, omissions, or corrections? Seeing none, can I get a vote to adopt the minutes? Thank you, that's carried. We have no delegations at the time, so we will move on to the General Manager's monthly report. And I will ask Carol to take that over.
Good afternoon, and thank you, Chair Brose, and welcome members to the Renfrew County Housing Corporation Department report, highlighting some of the activities for the previous month. So my report is, it begins on page 2 of 6, and we're going to start with the applicant tenant issues. And that's just an overview and summary of the applicants that we currently have waiting with the Renfrew County Housing Corporation and with our nonprofits. So when you will recall approximately a year ago, we did a mass cleanup of the registry. We were over 1,000 on our wait list. I believe it was close to 1,500. So you'll notice that we're creeping up there again. So there is definitely an interest in rent-geared income housing within the County of Renfrew. New senior applications, we have 11. So those are folks 65 years of age and older that are applying for rent-geared income housing. We have 36 new adult applications, and we have 22 new family applications. The next chart that follows is the total number of applications that we have received as at the end of December by bedroom size. And then if you move to the top of page 3, you'll see the total number of applicants that we have by bedroom size. So we have 119 seniors for a 1-bedroom and 10 for a 2-bedroom, for a total of 129 senior applicants. And I think that's important because this morning you probably all heard about the senior strategy that was delivered by Ken and Scott. So this is important, although it's not depicting the actual full need throughout the County of Renfrew. It is indicating that there is definitely a need there. Adults, we have a total of 417. We have 23 couples and 394 singles. And we have 418 family households looking for rent-geared income housing. The chart that follows is our summary of our move-ins and move-outs and our transfers. And they have been very light in 2020. So I don't even think we hit 100 move-outs in 2020. And that's the lowest number of move-outs that I can recall with Renfrew County Housing Corporation. Moving on to the second item, which is the financial. And unfortunately, we don't have an operating budget to share with you today, and nor do we have a capital variance report, but those will be coming back to you in our next report for March. But what I would like to say is congratulations on the passing of our 2021 budget. So it feels like a new year every time a budget gets passed, and then we're starting over again. So we did have great success in 2020, even with all the hiccups with COVID. I'm sure that 2021 will have many more successes. They will be different for sure because our challenges are changing slightly for us. Just the challenge with COVID alone can cause some issues in the operations of Renfrew County Housing Corporation, especially within our capital budget. And even the operating, we are going to see probably some conflicts with our contractors, probably in the availability of contractors. It might be good, it might be bad. It's hard to say. We'll have to see how things move forward. And then, of course, the supply and demand for the product. I mean, we've certainly seen the costs go up. But at the same time, the work orders have been a little bit less than normal because we have only been doing emergency work orders for the biggest part of 2020. So we'll see how 2021 goes and what that looks like as we move into our new green phase and start getting back into regular business and moving away from just doing emergency work. The current tenant arrears information is attached for you. So if we take a look at the arrears, you'll notice that we have a number of tenants that have a current balance. We're working with each individual tenant and their circumstances to help them along the way to get those cleared up. So we have a total of $81,593 of money that's owing to Renfrew County Housing Corporation, and that is affecting 120 of our tenants. So moving back to the report, and I'll bring you back to item number 3, which is the Canada Ontario Housing Benefit. So I wanted to bring to your attention that late December, we received a letter from the Ministry of Municipal Affairs and Housing advising us that there was a temporary pause to the Canada Ontario Housing Benefit. The temporary pause is because they felt that they had overextended themselves and that the money had been spent. So we quickly had to get every application that was in process into the system immediately so that they would be granted their Canada Ontario Housing Benefit. We currently have 113 participants receiving the Canada Ontario Housing Benefit, and the monthly average subsidy for those 113 is $284.33. People are calling every day asking and inquiring about this benefit. So when it opens again in April with our new allocation, which is approximately $64,000 above what we currently have, which is 204 on an allocation, we expect to fulfill that amount very quickly. Item number 4 is just a COVID update, just to let you know where we're sitting with that. We continue to share and educate our tenants and thank them for their ongoing patience with everything that's going on, and educating them about the stay-at-home order, which is now ceased. The tenants have been excellent with limiting the visitors to the building and keeping it to essential visitors, being folks that are delivering groceries to them or providing medications or home care of some sort. The final item that I bring to you today is just an update on the Rent Cafe. So we have 2 applications that we widely use at Renfrew County Housing Corporation, and that is, they're both through Yardi. We have a property management system and we have our Rent Cafe system. So they are now going to talk to each other. So hopefully by March, when I come back to you, we will now have 2 systems that are interconnected, which means we will have a little bit of time savings, not a whole lot, but a little bit of time savings. And they're doing this for us at no cost. So that is always good news when it's a benefit to Renfrew County Housing Corporation and is at little or no cost. So no cost to us, a little bit of staff time, and everybody's happy. So, Chair Brose, that concludes my report for today.
Thank you for that report, Ms. Neal. So going back to information item number 1, the applicant tenant issues and the Rent Cafe community housing. Are there any comments or questions on item number 1? I see none. So item number 2 is the financial report, and we look forward to seeing the operation and capital budget at our next month's meeting. Are there any comments or questions on the current arrears? Yes, Councillor Giacono.
Thank you, Mr. Chair. No, I missed number 1. I'd like to go back to number 1. Do we have
Absolutely.
do we have a handle on a percentile of residents that are using Renfrew County housing in proportion to the number of residents living in in the county itself. Do we have a percentile? Do we know, what the ratio would be? Is it 10%, 2%, 0.5? I'm just curious. Would we have a number?
Ms. Neal, do you have an answer for Councillor Giacono?
Through you, Chair Bros, to Councillor Giacono, that's an excellent question. And I don't have the percentage on the tip of my tongue, but it's certainly one I think that we can attain for you and bring back for sure. We'll have that for the March meeting. Very good. Thank you.
Thank you, Carol. Any other comments or questions on item 1 or 2? Seeing none, item number 3 is the Canada-Ontario Housing Benefit. I just had one question for you, Carol. Is there a risk, so people who are looking for that subsidy but can't reapply now until April, is there a risk that they may lose their housing if they can't get access to that extra funding?
That's an excellent question. We're very fortunate right at the moment. We do have an additional program that we can assist folks with temporarily until they can get hooked up with the Canada Ontario Housing Benefit. We don't have a lot of funding left in that pot, but we have a small amount of funding that can assist for sure.
Thank you. And I would assume even when the funding reopens in April, it's probably not retroactive.
No.
Thank you. Item number 4 is the COVID-19 update. Once again, I'd certainly like to thank Carol and her staff for the work that they do with our tenants, keeping them informed and staying in touch with them as the rules tend to change sometimes overnight. And it's always a challenge, I'm sure, to keep everybody informed. Any other comments or questions? Seeing none, then item number 5 is the Rent Cafe. So this, just if you could explain a little more, Carol, is this, I imagine it's really going to streamline and speed up the process. And does it require additional training for your staff, or is it pretty user-friendly?
It's a great question. The Rent Cafe program is very user-friendly, and with our online application process, staff are very pleased with that. It's very efficient. And then when we house a tenant, then that Rent Cafe application process will then talk to our property management system, the larger Yardi application. So folks won't have to be doing as much data entry. So there was a little bit of duplication in that area, which then leads to some possibility of error. So this will streamline the process and be more efficient.
Thank you. We're all about more efficiency in Renfrew County for sure.
Yeah, and our staff are very versed with Yardi and very knowledgeable in that area. So troubleshooting is not an issue at all for them.
Thank you. So that brings us to the end of your report. Could I get a resolution, a mover and a seconder to adopt the report, please? Moved by Councillor Love, seconded by Councillor Reinwald. Any other comments on the report as a whole? Seeing none, I will call for the vote. All in favor? And that is carried. Thank you very much. Is there any new business? Seeing none, we have no closed meeting at this time. The date of our next meeting will be Wednesday, March 17th, St. Paddy's Day. And seeing no more business for Renfrew County Housing, then I will need a mover and a seconder to adjourn. Moved by Councillor Regier, seconded by Councillor Grills, all in favor. And that's carried. Thank you. So we will move right on into our Community Services Committee report. So I will call the Community Services Committee to order. Roll call has been taken. Are there any disclosures of pecuniary interest and the general nature thereof? Seeing none, I will need a mover and a seconder to adopt the minutes of the previous meeting held on January 13th, 2021, moved by Councillor Love, seconded by Councillor Reinwald. Any additions, corrections, or omissions? Seeing none, all in favor? And that is carried. Thank you very much. We have no delegations at this time. So moving on to our Community Services Department, I will ask Laura for the presentation of the department report, please.
Good afternoon, members of Community Services Committee. I'm pleased to bring you to page 2 of the report. And under item number 1, it's an information item, and it's the Social Services Relief Fund, Phase 2. As you may recall, committee, we had a meeting back in August where we were tasked with coming up with a plan to put forward to the Ministry of Municipal Affairs and Housing on the second round of social services relief funding. And we did put a plan in on September 11th, supported by committee and council. In that plan, we also had to identify that should there be additional funds available, what they call a holdback, would we be able to use additional funds? And we identified, of course, we could. It would be building on the plan that we already had in place. So if you recall, our Social Services Relief Fund was focused in 2 areas, supporting seniors and disabled adults through the Community Support Network in Renfrew County, and supporting families in community housing. So the additional funding of $332,600 has been announced for us. We're very pleased to receive this. And the plan for this is to, of course, follow the original business plan from September, which would be to support the seniors and disabled adults in our community with additional transportation and to provide additional supports within our community housing portfolio, which includes items such as hands-free entry and physical distancing, benching, and such for outside. So you can see the attached letter, which will outline kind of the announcement, and the appendix, which outlines the conditions of the funding. Item number 2 is the Seniors Housing Strategy Update. So you will recall back in 2020, the consulting firm of REFAC Consulting was engaged to assist in the development of a seniors housing strategy for Renfrew County and area. They did complete a very comprehensive review of senior services across the county, and they created a seniors housing strategy presentation, which was presented earlier this morning in Health Committee, which I believe our Community Services Committee also attended. This looked at services such as assisted living, supportive housing, long-term care, community paramedic partnership in the client's home, and additional long-term care beds. They reached out to a wide variety of community stakeholders as part of their study process and received feedback in terms of developing this document. And of course, the link is available to the housing strategy in this report, and I believe you also received a copy of the report as well. It was a very comprehensive presentation this morning with some really key recommendations that will greatly impact not only across the Health Committee, but I think will impact across our community services as well. And that, Chair Brose, concludes my report. Thank you.
Thank you, Ms. Lapine. So going back to information item number 1, the Social Services Relief Fund, Phase 2. Are there any comments or questions? Seeing none, item number 2 is the Seniors Housing Strategy Update. Any comments or questions? Yes, Councillor Giacono.
Thank you, Mr. Chair, and the rest of the committee. As I said rather casually before, there seems to be an exodus of people coming from the larger cities to live in smaller communities such as ours. And I think the province may in the very near future, be placing a plan in place under the Planning Act to perhaps restrict size of growth in communities in order to offset, challenges that we've been faced at, such as COVID. And as we all are aware, in the larger centers, in the larger areas with seniors housing, et cetera, there's been a lot of fatalities. And I think it's based on the transmission due to population. And I think in the future, the province wants to look at, I may be dreaming this, but I truly believe that will happen. They're going to look at areas such as Renfrew County or areas that are rural and say, perhaps we should restrict growth in order that we can contain outbreaks such as COVID. And if we look at Renfrew County's their track record on the COVID virus itself, I think that we've stood out within the province, if not the country, because of the way we've handled things here. So my and a long convoluted answer here, a question. As senior housing continues, and we expect seniors to come here, are we anticipating that we'll be able to adapt with this influx of people coming to our communities? And I believe, I'm telling you right now, I've talked to 5 or 6 people that have moved here from Toronto for the exact reason to get away from that threat of COVID, to be distanced in an area where they can have some space. So are we making any preparations for the future? Do we anticipate any additional costs that we may face because of what will be happening here, based on my convoluted prediction? I know that's a big question, but I think we're going to have to look at that.
Ms. Lapine, did you want to weigh in on that?
Thank you, and through you, Chair, to Councillor Jacquinot. I think you raised some really good points, and certainly, some of the comments that you've made are reflected in other communities of a rural nature. I think there's been discussion at different tables that I participate in that some of the more rural communities have seen an influx of residents into their community. In terms of planning and further discussion around how we could possibly meet this need, I don't have anything to bring to you today, but I think this is something that we need to have a conversation on. I think that there's more work that is being done in that regard. Thank you.
Yes, follow up, Councillor Jacquinot.
Thank you. Just as a follow-up, Mr. Chair and members of committee, should we as a committee be preparing a long-range projection for the next 15 years as to what to expect? I know we look at the long-term picture, but I truly believe that a plan of that nature should be in place so that all of a sudden we're not going to be faced with, and I shouldn't say epidemic, but a large movement of people from one area to the other, and now suddenly we have to start absorbing the costs.
Paul, you had your hand up. Did you have something you wanted to add to Laura's response?
Thank you, Chair. Maybe just in response to that, I think there's a number of different things that we've been hearing that in part addresses Councillor Jacquinot's concerns. One, this morning we heard from the REFAC Consulting on our seniors housing strategy that puts in place and talks about putting in place some of those things with respect to the long-term projections as you speak about. And that is putting in place things like our community paramedic program. So it's putting together our palliative care program and our in-home support program as well. So there are those things that the seniors housing strategy speaks to that will support exactly what you're talking about. The other pillar that we need to consider, and we're going through this as an organization, and that is the development of the county official plan. So the ultimate limit to people moving into this county will be the availability of housing supply. And that too is referenced in the seniors housing strategy. So that in itself, the market will dictate how many folks are able to move into our our area. Right now, I believe the number in the county of Renfrew is approximately 77 homes available for sale right now. So that, that factor in itself causes an issue. We want growth in the county of Renfrew. The supply is not there. So there are some things in there. The market will limit it as well, but I do appreciate your comments. So both from the planning side of things and from the perspective of us planning through the seniors housing strategy, the county of Renfrew is looking at both those avenues to manage those types of situations. Thank you, Chair.
And I see Mr. Kelly has his hand up. I'm assuming he wants to add to that as well.
Thank you, Chair, and through you. And Paul hit the nail on the head. I just want to hit it again that Councillor Jacquinot raised a good point and worthy of a discussion with all municipalities. It's in the OP, but as outside of this is the ability for your, and the province is big on these, your ability for your municipalities to look at second dwelling units as an alternative to housing. So while seniors are moving back, some of them are moving back to either housing that's not acceptable or they want to be near families. So converting or creating a new building on the same lot, we all have large acreages perhaps in this area. So, if you have a bigger than a couple acres, maybe you put a granny suite on your property or secondary dwelling. And there's provisions to do that in an easy fashion. And there's also the pressures that we're feeling in some of the other communities where seniors are moving off of their cottage lots into towny homes and trying to manage that effect as well. Or positioning when they move home, they're actually moving home to seniors or to seasonal cottages and actually making it more difficult once they move back to the cottage as a full-time thing. So we recognize that, and I have worked with Laura on this and will be working with her. So just wanted to from the DNP side, we recognize it, as Paul has mentioned, and happy to, or at least our planning staff is happy to work with your municipalities to work through some of these pressures that you may be feeling to bring seniors back home and keep them at home.
And once again, Councillor Jacquinot, just to follow up.
Thank you. I'm not trying to hog the conversation. I just feel really strongly about this. As the CAO had mentioned, there's, 77 available units within the county. I believe that's what he said. But the fact remains that Renfrew is planning, condominium development of over 1,000 condominiums. In Pembroke, we've got a developer back from the Toronto area looking to build 500 or 600 homes. There's also internal interest to build homes and infill within small, communities such as our own. So I think in the very near future, that number of 77 is going to be an astronomical amount of houses and buildings that will be available, not only to the people here, but people that are migrating from out of the community. That's my concern.
Thank you, Councillor Jacquinot. Now I have Councillor Arrears and then Councillor Reinwald.
Thank you very much, Chair. I just wanted to follow up from the presentation this morning. That was excellent. I did just want to mention that at this time, Whitewater Region, we are right now undertaking this very same project. We recently secured a grant where we were able to get Barnes Consulting, who right now are going through the process of reaching out to community members and whatnot. So we hope to have this wrapped up in mid-March. But I just wanted to make the point, and it was this morning something that Warden Robinson mentioned, and it kind of hit home to me, and it was, she mentioned that the County of Renfrew cannot be a sole partner here when it comes down to this type of to housing and to senior living. And I think we have to look at all municipalities working together to make this happen. And I think I'm just fortunate that here in Whitewater, we have already got a bit of a start on that. So I'm looking forward to the final product to see where we land and where we are right now with this housing strategy. So thank you very much.
Thank you. And Councillor Reinwald, you had a question. No? Okay. Just to follow up on both Councillor Jacquinot and Councillor Arrears' comments, the thing that jumped out at me from this morning's presentation on the seniors housing strategy was the one of the things they identified, that was the fact that there seems to be some uncertainty on people through the seniors housing or some of the associated services that the county delivers, such as paramedicine and such as Ontario Works. And there's such an overlap in those services. And I guess the other challenge right now is because of the uncertainty with the LHINs and the community health networks, there seems to be that uncertainty between who is actually leading the charge moving forward. And I do agree with Warden Robinson as well, that it should not be the county's sole responsibility, that each one of us as a municipality has our, we're part of the game as well. But having said that, I do think at the same time that there's an opportunity, because of the amount of services that the county delivers, and because we've been so innovative and so adaptable at managing some of the challenges, either through COVID or delivery of the paramedicine to seniors. I think we as a county also have an opportunity, maybe, and the other councillor that spoke to it this morning was Councillor Emo, where he said, we've become such strong advocates at the county of Renfrew that we may have an opportunity here to lead in delivering some of that more, unified and a more streamlined approach to some of these services. So I found that report was very, very timely and very well done. And it'll be interesting to see how we can adapt moving forward. Thank you. Are there any other comments or questions? Seeing none, thank you very much, Ms. Lapine, for your report. That will bring us then to our Ontario Works Division report. And Ms. Patrick.
Thank you, Chair Brose. Through you to committee. Good afternoon, members of committee. The Ontario Works report starts on page 10 of your electronic package. Item number 1 is the Ontario Works caseload statistics. And you'll note that we finished out the year 2020 continuing in the downward trend that we have seen since the onset of the pandemic and since the federal financial assistance benefits became available. So those benefits, as we discussed last month, are set to start expiring in March, so next month. So we will be keeping a close eye on the caseload trends and what impact we see when the federal benefits become exhausted. So I'll keep committee fully informed with respect to that. Moving on to item number 2 is our homelessness prevention program statistics. This program, which is delivered in partnership with Renfrew County Housing Corporation, continues to be a program in very high demand. As committee will note, we are continuing to trend at approximately 100 applications a month and approximately $100,000 of support going out to community residents through that program. There was a pause on residential evictions during the stay-at-home order, but that did not result in any slowdown for us in the applications for assistance with rental arrears, heat and hydro arrears, and as well for homelessness assistance. Item number 3 in the report is the Ontario Works financial audit, which took place on the 26th of January with Scott Rosine, Black and Locke. Through that audit, 24 Ontario Works payments, which were randomly selected, of course, that had been issued in 2020 were reviewed by the auditor, and all payments were determined to have been issued accurately and correctly and in accordance with legislation, and there was no issues whatsoever identified. Moving on to item number 4, this is with respect to a new initiative that Lanark County is undertaking in partnership with their local community mental health organization to address homelessness. So attached for committee's information as Appendix 1 is an article about this initiative. the Lanark County Social Services Office is funding a registered counselor psychotherapist, which will be recruited and employed by their local community mental health organization. And the intention is that this staff person will be able to assist the individuals that are homeless in their community and try to help them to become stabilized and to be working in partnership with the Social Services Department to move forward in securing more stable housing. So just some additional background information on that for committee. Lanark County, at the time of the article being written, which was last month, they had 34 individuals that were homeless in their communities being provided with emergency shelter in local motels. And their Ontario Works caseload, total caseload, is 830. So just for comparison purposes, our caseload, as you'll note, is about 1,073, and we currently, as of this week, have 29 individuals that are homeless in Renfrew County. I think that's the highest we've been at since the start of the pandemic in our homeless numbers. We're trending at about 20 to 22 on a weekly basis, but just wanted to share that information with committee. In Renfrew County, as I had discussed last month in my report, we were approached by the OPP in November to form a homelessness prevention partnership with the police services, our community mental health organization, and the Grind, and ourselves, our own department, to look at working collaboratively together to address homelessness. We have been meeting on a monthly basis with those partners, and we did discuss the Lanark initiative at our last meeting. And for committee's information, in Renfrew County, all of the homeless individuals that we are supporting through the homelessness prevention program are also being assisted through the community mental health crisis team. And when they are working with the crisis team, they have access to the rapid access clinic. And what that means is that they're able to see a psychiatrist within 3 weeks. So they are given an opportunity to rather quickly be seen by a psychiatrist and not be, placed at the end of the waiting list. Community mental health also, the crisis team has access to psychotherapists through the Pembroke Regional Hospital. So our clients that we're working in partnership with community mental health do have access to those supports. Item number 5 is the Moving on Mental Health and Addictions most recent report card. So that's attached for your information. This table was formed in 2017, and the aim is for the mental health and addictions agencies to work more collaboratively and try to provide a more streamlined and client-focused system for those individuals who are seeking mental health and addictions counseling in Renfrew County. So they're trying to work on eliminating some of the gaps in services and working on not having gaps for clients when they transition from youth mental health services to adult mental health services and other challenges within the sector. So it's certainly very beneficial to attend these meetings and to learn about the progress that they're making in streamlining and making their services more effective so that we can be kept up to date and share this information with staff, and we can continue to keep the clients that we're working with connected with these supports. At the most recent meeting that I attended, which was on the 21st of January, the group was discussing an initiative that they're working on to bring a virtual mental health walk-in clinic to Renfrew County. So they are looking at partnering with a community health center in Ottawa to provide some virtual mental health counseling services for residents. So they're looking to do a soft launch starting in February, and then there will be a media release, they expect late February. So I don't have really any final details or firm details to share with committee, but I'll certainly keep committee well informed and bring back information as soon as I have more details, but really looking forward to that being another opportunity for our clients to get some timely service and supports in the area of mental health and addictions. Item number 6 on my report is the Provincial Municipal Human Services Collaborative Table. This is a new table that has been formed. It's being chaired by the Deputy Minister of the Ministry of Children, Community and Social Services, who is Janet Menard, and co-chaired by the President of OMSA. There is a representative from each of the 47 CMSMs and DSABs on the committee, as well as from at least 7 provincial ministries. And the intent of this group is to work collaboratively on planning for the social assistance transformation and making sure that there's partnership between the province and the municipalities in the planning and the rollout for this transformation. The initial meeting, which was held on January 29th, they talked about the high-level vision for the social assistance transformation and, you know, really working towards automating and digitizing many of the financial benefits that are issued and paid for by the province, and ensuring that the local municipalities continue to provide those essential human services supports for local residents in a very integrated manner. So I'm very pleased to have the opportunity to sit at this table. It is a confidential table, but they've assured the group that there will be information and slide decks to share with local committees and councils in closed settings. So as soon as I have any information and details to share further than the outline, I will certainly keep committee informed with respect to that. And the final item on my report this month is about staff training. So the Ministry of Children, Community and Social Services has partnered with Western University to develop and deliver some e-training in the area of domestic violence. Following a review by the Domestic Violence Death Review Committee, it was identified that social assistance staff across both the Ontario Works Program and the Ontario Disability Support Program are often working with individuals and families that may be experiencing domestic violence. And it was recommended that they receive more specialized training to help them identify risk factors and be aware of when to connect clients with further supports to ensure their safety. So we're certainly going to have all of our staff trained in this area. It's about a 4-hour e-training session that's delivered in broken down into modules. So we have the opportunity to train all of the staff, and we'll be working at that over the next couple of months to get all our staff trained in this important area. Thank you, Chair Brose. That brings me to the end of my report for this month.
Thank you, Ms. Patrick. So we will move back to information item number 1. That's the Ontario Works caseload statistics. Are there any questions or comments? Seeing none, item number 2 is the homelessness prevention program. Councillor Giacono.
Thank you, Mr. Chair, members of the committee. Thank you, Angela. I'm glad to see that the OPP, yourself and your staff and the mental health people have been meeting on an ongoing basis to help the homelessness problem within the county, not just City of Pembroke, but within the county. I think it's very vital that that you're streamlining services to show that there isn't a lot of duplication, and that the individuals will get the assistance that they need, in the shortest length of time. I'm also very pleased to hear that there may be some psychiatric availability to some of these these folks, because many are dealing with mental health issues, and sometimes just having the availability to talk to somebody, in a very personal matter, such as a psychiatrist or somebody that may be able to delve into their problem, can solve that problem fairly quickly. But as we all know, I mean, in order to to access this service, you have to want to be helped. You just can't be thrust into into that terrarium and saying, here you go, now we're going to help you whether you like it or not. And we know that you need to understand that you have a problem and that there's somebody there that can help you. And I want to congratulate you and all of the folks who've been working together. I think that is so invaluable. And I guess the goal is to see that there is no homelessness. Like, we don't want homelessness. We want people to have a home, to have a place to go. Thank you again.
Thank you, Councillor Jacquinot. Councillor Aguirre, you had a question or comment?
Just a question. Thank you, Chair. I'm just wondering if, while we are doing the statistics for the Ontario Works caseload, if we could include the homeless numbers, the number of persons, because as Andrea just mentioned, that they went from 22 to 29, it would be good to have that information moving forward, just to see if we're on a downward trend or moving up, or where we're at with that. Thank you.
Thank you, Councillor Aguirre. And just to add to that, that was something I was going to bring up as well. I'm wondering if we're doing those stats, if we could break it down as well into like a 0 to 30 age category, 30 to 50 and 50 plus. Because I think that would indicate as well where, especially as we listen to the seniors housing strategy this morning, we might start seeing some fluctuation in the numbers there moving forward. So yes, I certainly agree that that would be a worthwhile stat. And I guess the other thing I just wanted to say, and again from the report this morning, I think it is a worthwhile exercise working closely with the police departments, because homelessness, as we heard, can lead to other mental health issues, or can be a result of mental health issues. So having that collaboration and that partnership, I think, makes it easier for police, that they're not dealing with as many crisis calls, and also helps get some of our people back on track that need that support. Any other comments or questions? Seeing none, we'll move to item number 3, which is the Ontario Works financial audit. No doubt your staff, Andrea, is doing a fantastic job. Item number 4 is a new initiative in Lanark County to address homelessness. Item number 5 is the Moving on Mental Health and Addictions Planning Table Report Cards. Comments or questions? When I read the report, I was also pleased to see how the different support agencies are working together and have now developed a common intake form, so that regardless of which service you may approach first, the form is the same and the information is transferred then from one service organization to the next, which again makes it a little more streamlined and easier for the clients to navigate. Item number 6 is the Provincial Municipal Human Services Collaborative, and comments or questions. Ms. Patrick, this is part of the pilot project, correct? And some of the county involvement and leadership once again in moving this forward.
Thank you, Chair Burrows. Through you to committee, that's an excellent question. It certainly involves the pilot, but it's really not part of the pilot. This is a new table that they've formed to work on kind of the larger picture of the social assistance vision. And yes, absolutely, part of that transformation involves the centralized intake pilot, which County of Renfrew is one of the service managers participating in the pilot. And eventually they are wanting to, of course, roll that out so that, you know, intake will be done by the province, across the province, and moving towards an automation of those benefits and payments being issued from the province. So it absolutely feeds into it and is a part of it, but the table is you know, more of, I think, sort of larger even than that, and looking towards future planning for working very much hand in hand with the municipalities about, planning for, what can the province do and what do they do well and what do the municipalities do and do well, and making sure that the local voice is heard at these tables so that as future planning, it works for the rural municipalities as well as the more urban ones, and that those supports that local service managers are providing around, the Ontario Works life stabilization, as well as housing supports and childcare and other local services are, remain a focus on the importance of those and ensuring that we're delivering them in a very integrated way, in a very client-focused way.
Thank you, Ms. Patrick. Are there any other rural municipalities involved in this, or is Renfrew County the only one, or do you have other partners at the table from the rural sector?
Thank you, Chair. Through you to committee. So at this Human Services Collaborative table, there is a representative from each of the 47 service managers across the province. So everyone, there's full representation. And as I say, representation from our ministry, the Ministry of Education, the Ministry of Housing, and several other ministries.
Thank you. Any other comments or questions? Item number 7 is the staff training. Once again, I think this is so valuable because your team of people in or staff in the Ontario Works certainly interact closest with the residents that need the services, and I think this is a very effective tool in recognizing some of those situations that might require other intervention. Any other comments or questions? Thank you very much, Ms. Patrick. And that then brings us to our Child Care and Early Years Division report. And Ms. Mulvihill, did you want to
Thank you, Chair.
take that?
Oh, sorry to interrupt you twice on that. Thank you, Chair.
No problem.
Hello, members of committee. I'm just going to exit my full screen so I can let you know what page we're on my report. My report begins electronically on page, I'm scrolling down without a mouse today, so just bear with me. Page 19. I'm also dealing without my cheater readers today too, so I'm working a little shorthanded. So item number 1 and 2 are our statistics. You will note item 2 is our targeted emergency childcare that took place over the period of 3 weeks. Very short-lived, but extremely successful in the county of Renfrew. We were able to serve a large number of families, a large number of new families who have stayed on in the system, which is quite good for our system. Item number 3, some more good news for the county of Renfrew, is the reinvestment of some provincial funding to support the pressures through COVID from the period of January 2021 to March 2021. Our allocation is $367,000 and change. We have already gotten out to our providers a request for funding form that outlines the bulleted parameters for the funding. We meet with our providers every week. We've already reviewed this with them, and plans are well underway at each of their sites to request funding as required. Item number 4 is a resolution, and this item is related to capacity funding. And capacity funding is a 100% provincially funded amount that we need to use to spend on professional engagement with our childcare providers. Where the County of Renfrew is unique is that we've partnered with Laurie Baird for several years now, and we're not just engaged in drive-through training where it's a one-off training workshop. This is an ongoing piece of training. She's heavily engaged right at the ground level with our childcare providers. And we've brought on Dr. Jean Clinton this year, who is a fantastic resource and a huge provincial if not world leader in pedagogy for children. And it's great to have her availability. And I think, one of the good benefits of COVID is she's a little bit more available to us. So we've been able to tap into some of her mentorship as well. So the recommendation is that the Social Services Committee recommends to County Council the approval of Lori Baird and Dr. Jean Clinton providing professional development training to early on and licensed childcare providers throughout 2021 utilizing capacity funding. And that, Chair, concludes my report.
Thank you, Ms. Mulvihill. You've heard the resolution, so can I get a mover and a seconder? Moved by Councillor Arrears, seconded by Councillor Grills. Are there any comments or questions on the resolution? Seeing none, I will call for the vote. All in favor? And that's carried. Thank you very much. So we'll then move back to information item number 1, which is the Special Needs Resourcing Statistical Report. Comments or questions? Item number 2 is the Targeted Emergency Childcare. And I'm just going to jump in here and just give me a second. I just want to bring it up on my phone. And I know from the delegation that we had at Roma with the Minister of Education to bring forward the concern we had regarding the disparity in pay with some of our early childhood educators, as well as the challenge in not just only recruiting, but retaining the ECE staff. And this was a really interesting stat that Ms. Mulvihill brought forward for the delegation. It says in February pre-pandemic, the ratio of staff to children was 1 staff for every 5.6 children. And that's over all age groups combined. And that translated to 233 staff for 1,322 children. In November, the ratio of staff to children was 1 staff for every 3.4 over all age groups, which translated to 280 staff to handle 946 children. So it meant that we're now serving 71% of the children, yet we're needing 47 more staff. So you can certainly see where that does create a challenge in attracting those additional childcare support people. And as Ms. Mulvihill explained in some of her meetings with the province and the Ministry of Education, the other thing that isn't sometimes given much attention is the fact that these childcare workers that work in the private centers, they don't get any benefits. They don't have access to a pension plan. They don't have access to the health benefits. And again, that means that not only is there a wage disparity, there's also a disparity in, that problem being exaggerated through the lack of benefits. So after our delegation, there was a very nice email that was sent to Ms. Lapine from Phil Graham, and he's the Assistant Deputy Minister for Early Years and Child Care Division at the Ministry of Education. And he said, "Thanks, Laura. It was great to connect with you, and you guys did a great job presenting the key issues facing the sector and your community. Was good for the minister to hear this firsthand, and I think it will help us drive towards solutions. Keep up the awesome leadership." So I just wanted to say hats off once again, and thank you to Paul and staff and Judy and Laura for the excellent work that they did in collecting the data and putting together the report that certainly makes the presentation that much easier. So I certainly wanted to pass that on and hoping that we get to see some changes in how our ECEs are compensated.
Thank you, Chair.
Item number 3 is the provincial childcare and early years funding reinvestment. Will you have any problem spending this money, Judy?
I'm not sure. I think it's adequate. I don't have concerns that it's not enough. I'm waiting to see what the providers request. I will know more within the next couple of weeks, Chair.
Thank you. And we've dealt with item number 4. So is there any questions or comments on the report as a whole? Seeing none, then I will ask for a mover and a seconder to adopt all of the reports as presented. Moved by Councillor Love, seconded by Councillor Grells. All in favor? That motion is carried. Thank you. Is there any new business? Seeing none, we have no closed meeting at this time. The date of our next meeting, Wednesday, March 17th, 2021. And that concludes our meeting. So once again, a reminder that our County Council meeting is Wednesday, February 24th, 2021. Can I get a mover and a seconder to adjourn? Moved by Councillor Love, seconded by Councillor Giacono. All in favor? Thank you all very, very much. We are adjourned.